So the second role we've said it's maintaining the fluid function or the fluid balance of T, whereby the blood proteins, albumin and globulin, help maintain the fluid balance in the body. And that is where you'll find that for children who have the protein energy malnutrition, have a lot of accumulation of fluid within their system. So we are saying that usually blood pressure is in the arteries forces the fluid out to the extracellular space to take the nutrients to the cells. Nutrients usually counter this by attracting fluid back to the blood, that is osmotic and enterotic pressure. So if a person does not eat enough protein, water is retained in the tissues, that is edema, and conditions that lead to edema include heart diseases, the kidney diseases, liver diseases, pregnancy, and also what we mentioned, the children who have the PEM, the protein energy malnutrition. Another role of protein is contribution to acid-base balance, whereby the proteins act as buffers by providing hydrogen ions to maintain a neutral pH. Also, it forms glucose. If the diet does not provide enough carbohydrates, then the liver makes glucose from amino acids through the process called gluconeogenesis. Then again, proteins do provide energy, whereby we've already mentioned that for every 1 gram of protein, it yields 4 kilocalories through the process of deamination, and with that, the body is able to be sustained. Yeah, we have the protein foods. Maybe I'll just mention, I've already talked about the major food sources. I've talked about the animal sources and the plant proteins. Like we do have mostly plant proteins. We have like the beans, kamande. We have the kamande is the lentils. Yeah, we do have the njahe, that is the black-eyed peas, our beans. We do have the peas. We do have the green grams, that is dengu. There are quite a number. So the proteins in our foods, mostly you'll find that fruits and fat do not have any protein. Vegetables have at least about 2 grams per exchange. The starch and bread have about 3 grams per exchange, and the meats do have 7 grams per exchange. Meat do have 8 grams per exchange. So if we lack protein in our bodies, especially amongst children and adults who have some chronic illnesses, they're likely to suffer from what we call PEM, that is the protein energy malnutrition. It's a condition caused by consuming insufficient amounts of protein and kilocalories over time. The deficiency results in body wasting and its increased susceptibility to infections. So you'll find that 500 million children are affected by PEM. That is very sad. That's quite a high number, yet this can be avoided. So those who are most likely to be affected by the protein deficiency are the infants and children, especially in developing countries, those around the world who live in extreme poverty, also the elderly who live by themselves, those with eating disorders such as anorexia nervosa, or who simply don't eat enough, those addicted to drugs or alcohol, especially when combined with low income. Also, those pursuing a low protein diet for a reason, including fads and weight loss. Also, those with tuberculosis or AIDS, those whose main diet is also low in protein due to poor food choices, eating too much junk and such. Also, those diseases like TB, AIDS, we do have also cancer. It's a wasting disease because it eats up the body's muscles. All right, we do have Koshoko as a deficiency disease. It's part of PEM, the protein energy malnutrition, and it's as a result of inadequate protein intake. And in most uh, cases, you'll find that it's common in among children between age 1 to 3 who are unable to meet their high protein needs with the available diet. So usually its symptoms include apathy, listlessness, failure to grow and gain weight, withdrawn. The child also has edema, dry, flaky, paint skin, anorexia, enlarged liver, thinning and loss of hair, color, and also infection and parasites. On the other hand, we also have marasmus as a form of PEM, which is now a severe deprivation or impaired absorption of energy, protein, vitamins, minerals, causing severe body wasting. Marasmus is common in children from ages 6 to 18 months. 166 from the time the child starts being weaned off or complementary feeding up to 18 months. When the child is 1.5 years, marasmus is very common amongst them. What brings it about? Most illnesses or infections and diseases, also improper weaning practices. We have another cause as famine and other disasters, ignorance of caretakers or caregivers, poverty, and also mother's education. How do we differentiate it from Koshoko, you'll find that with this one, the symptoms are failure to grow and gain weight, very wasted, no subcutaneous fat, illness and infections, no edema, hair sparse, thin, dry, you can be able to pull it out, good appetite, skin dry easily, wrinkles. So both marasmus and Koshoko are characterized by edema for Koshoko and wasting for marasmus. And the combination of infection, fever, electrolyte imbalances, and anemia often leads to heart failure and occasionally sudden death. Its rehabilitation, basically, it's 24 to 48 hours, where we do have fluid and electrolytes to blood pressure and strengthen the heart. Also, we have protein and energy foods in very small amounts gradually. So, have it that it's easier to treat marasmus than Kwashiorkor. Yeah. So, maybe next we can focus on protein digestion. And as already mentioned, you'll find that proteins are crushed and moistened in the mouth, just masticulation, but there is no digestion that happens in the mouth for proteins. So usually it happens in the stomach because of the HCl, that is the hydrochloric acid, and it denatures the protein so that digestive enzymes can act on the peptide bonds and also convert the inactive form of enzyme pepsinogen to active form of pepsin. Pepsin breaks down large polypeptides into smaller polypeptides and some amino acids. So in the small intestines, usually the pancreatic and intestinal processes hydrolyze the polypeptides further into short peptide chains, oligopeptides, tripeptides, dipeptides, and amino acids. The trypsin, among other processes which digest the protein in the small intestine, breaks the large proteins to peptides. About its absorption, the cells of the small intestine absorb amino acids and have peptidase enzymes on their surfaces that split most of the dipeptides and tripeptides into single amino acids, and the membranes of intestinal cells transport the amino acids into the cells where they are released into the bloodstream. So that is the story of the proteins. And by now, I know now we are able to, we've learned about the proteins, and we've said they are made up of the amino acids, and they do consist of a carbon atom with a hydrogen atom.
You are currently the only person in this conference. You are currently the only person in this conference.
Now with vitamin E, I've said that it has functions. Primarily functions as a fat-soluble antioxidant and primary defender of the body against oxidation, protecting the lipids against other vulnerable compounds, and function and regulation of the immune responses through cell-mediated immunity. And also the vitamin derivative is found to be necessary for coenzyme Q, cancer, arthritis, and ischemic heart disease by preventing pre-oxidation and maintaining integrity of cellular membrane, prevent oxidation and beta carotene. Vitamin A and vitamin C prevents lipid pre-oxidation and polyunsaturated fatty acids that is in the cells. So they're used in food industries as antioxidants and permitted food additives. So about the deficiency, there's the hemolysis of the red blood cells, loss of muscle coordination and reflex, impaired vision and speech, deterioration of respiratory muscles, association with some types of cancers. Food sources, basically the oil seeds for vitamin E, eggs, nuts, soybean oil, wheat germ, plant oils, and also the green leafy vegetables. Then about the vitamin K, we are on a deck, so the last nutrient that is fat soluble. With vitamin K, it's found in plants and synthesized by bacteria in the gastrointestinal tract. And vitamin K is essential for blood clotting. It also participates in the synthesis of bone protein. A deficiency of vitamin K that results in a failure of blood to clot. Since this is a problem in the newborns, an anti-K factor, an anti-vitamin K factor usually is medically given to the child as an anticoagulant. So at birth, sometimes you have to be injected this so that there's no coagulation of blood in their system. The function is that the main function is in the formation of a number of coagulation factors, such like prothrombin factor 2, 7, 9, and 10. In terms of its deficiency, the deficiency is usually very unlikely, but in case it occurs, its deficiency will lead to increase in the prothrombin time and thus increase the risk of hemorrhage, that is bleeding. Usually the recommended sources of food are the green leafy vegetables. Though the absorption is relatively poor as it is bound to membrane of the chloroplasts, some plant-derived oils such as the soya and canola oils are also rich with vitamin K. Further research is still required in this area about the food sources of K. So maybe we can now focus on the water-soluble vitamins. That is vitamin B and C, and B usually have the B complex because the thiamine, which is B1, riboflavin B2, niacin B3. So we have deficiencies to all these, whereby with thiamine we have what we call beriberi, that is caused by nervous system abnormalities, that causes nervous system abnormalities. Deficiencies are common in alcoholics. Riboflavin affects facial skin, eyes, and the gastrointestinal tract. Then the niacin is characterized by the 4Ds pellagra. The disease pellagra characterized by 4Ds, that is dementia, which has to do with the brain. The mental system is affected. Dermatitis, about the skin, there is infection in the skin, inflammation in the skin, then diarrhea, and then eventually death. We do also have another B vitamin called biotin or pantothenic acid, which basically is needed for the synthesis of glucose, fatty acids, and DNA, and the metabolism of certain amino acids. So its deficiency can easily bring in insomnia, which is lack of sleep, depression, muscle pain and weakness, and also fatigue. The food sources are liver, eggs, yolks, and and also yeast. Then we have vitamin B6, which is pyridoxine or pyridoxythamine. And this one basically helps the amino acids and fatty acid metabolism. Deficiency, like the previous one, can bring about insomnia, weaknesses, irritability, growth failure, impaired motor function, and also convulsions. Then we do have its toxicity. Because it's rare for the B vitamins to bring about toxicity, but with this one, when it's taken in excess, it can damage the nerves, bring about numbness, and also muscle weaknesses. The food sources include the meats, fish, poultry, green and leafy vegetables, legumes, fruits, and also whole grains. Folate usually go hand in hand. Iron. Iron, of course, is a mineral, but with folate and the B12 function so much in terms of helping the nervous system and the brain to function well. That is the central nervous system. So they're closely related, and each depends on the other for activation. You find that folate is necessary for the DNA synthesis. It plays a major role in the cell differentiation. Those bone marrow where the are formed, and the requirements are increased during pregnancy, and folate supplements before and during pregnancy have been shown to prevent the neural tube defects, whereby child is born, but the nervous system, there's a place that there's a disconnection, rather it didn't complete its formation. Unapata mtu ni kama akona kitu kama nundu, something, a swelling at the back. That is a neural tube defect. Then we have vitamin B12, which is needed to maintain metabolism of the folate and fatty acids and to maintain the insulation, that is the myelin, surrounding the nerves. So its absorption requires intrinsic factors, which is a protein secreted in the stomach, and deficiency is a problem in vegetarians and individuals who do not produce the intrinsic factor. So basically, again, we just legumes, the seeds, like pumpkin seeds. We do have the sesame seeds, we have the groundnuts, the seed family. Also, the liver will give us with vitamin C. This one we know more about it because, okay, sorry, about the B6 vitamin, the folate and the B12. It was important for me to mention that it has deficiency diseases or conditions that will result, and one of them is immature large blood cells called megaloblastic anemia. Also, we have the blood disorder caused by the lack of intrinsic factor and characterized by deficit or blood Spanish anemia.
You are currently the only person in this conference.
With ascorbic acid, most of the time you find that it will function in terms of being easily oxidized, and it is able to protect other substances from oxidation in food industry. So in body tissues, ascorbic acid protects the easily oxidizable nutrients. It is effective in mopping up free radicals. It has preventive function for diseases in which free radicals are involved. It helps in absorption of dietary iron and also involved in the collagen, that is intercellular connecting protein, that is synthesis, formation of bone and teeth calcification, and many other reactions. So sources, we understand that usually with vitamin C, we get it basically from the citrus fruit. which are usually readily available in most of the time in season. And you can get them from the lemons, oranges. You can get them from the berries and melons. You can also get them from the tomatoes. Yeah, those are the major sources of the vitamin C. Passion fruits. Minerals.
You are currently the only person in this conference.
You find that they do perform a wide range of vital, structural, and regulatory roles because we define them as just being inorganic elements. And then we have major minerals and trace elements or minor. The major ones are the calcium, phosphorus, potassium, sulfur, sodium, chloride, and magnesium because they're required in larger amounts in the body, whereby on the other hand, we do have trace minerals that are required in smaller amounts in the body, whereby you do have the iron, zinc, copper, manganese, iodine, selenium. In terms of bioavailability, some minerals are bound by chemicals in foods. For example, the phytic and oxalic acid in legumes and grains that bind calcium, iron, and zinc, which I think I'd mentioned at some point when I was doing the proteins or the carbohydrates. Now, maybe to begin with the macro, we can mention just a few. We can begin with sodium, and it's a cation in extracellular fluid, and primarily it helps regulate its volume, it helps maintain the acid-base balance, and it's essential to nerve transmission for muscular contraction. Its deficiency can easily bring about muscular cramps, mental apathy, and also loss of appetite. Then its toxicity can bring about edema and acute hypertension. That is, sodium kwa kawaida tu ni kama table salt yenye tunatumia chumvi. So basically we'll get it from the table salt, from soy sauce, and also processed foods, meats, milks, and vegetables. So what you are recommended to take is at least 6 grams of salt in a day. That is 2 grams a day to prevent hypertension. Yeah, we just need a small amount, not as much. Salt addition on the table can bring about hypertension and other conditions. So another mineral that we can focus on is potassium, which is a principal cation within the body cells. Excuse, and it functions to maintain the normal fluids and electrolyte, facilitates many reactions, supports cell integrity, assists in nerve impulse transmission, and muscular contractions. This deficiency is likely to bring about muscular weaknesses, paralysis, and also confusion. And again, in terms of its toxicity, in case you take in excesses, it can bring about muscular weaknesses, vomiting, and can stop the heart from functioning properly. So you need to also limit its intake. Its food sources basically are the meat, milk, fruits, vegetables, grains, and legumes. Then calcium, it's the abundant mineral in the body and is found in the body's bone and teeth. Basically, again, you find that about 99% of calcium in the body's bone, bones where it forms an integral part of bone structure, providing a rigid frame that holds the body upright and serves as a calcium bank, offering a readily available source to the body fluid in case of a drop. So we find that 1% is found in the blood and fluids. Its main function is basically nerve functioning, blood clotting, immune defenses, and also muscular contraction and relaxation. So calcium balance is very important and is involved in a system of hormones and vitamin D that promotes calcium deposits into bone whenever blood calcium rises too high. Yeah, so we have some factors that would influence calcium absorption, like hormones that promote growth, ingestion with a meal or a stomach acid, then also vitamin D, lactose, or phosphorus. In terms of its deficiency, you'll find that children can easily get stunted and also bone loss in adults. And with stunting or not being able to grow as per the required age, sometimes we also have osteoporosis, whereby it affects most women at menopause. There is loss of calcium from bone and it becomes brittle and easily break. Calcium and vitamin D intake is sometimes poor. That's why osteoporosis arises. Also activity, smoking, alcohol, the caffeine, excessive acid use, and also diabetes. Okay, about phosphorus, you'll find that it's the second most abundant after calcium in the body, and it assists in energy transfers during cellular metabolism. So its food sources are the milk products like yogurt, small fish, tofu, dark green vegetables, and also the legumes. We will also put our focus now on the trace minerals, whereby now the trace minerals will say that those required in the body in small amounts, that is less than 100 grams, amount of 100 or less per day, and they include the iron, zinc, iodine, and also selenium. So with iron, the iron, I know we've heard about it all our entire lives, kinda. And it's basically important for blood formation and also helping us to just be okay. So it functions in terms of being part of the protein, hemoglobin, and part of protein, myoglobin in the muscles, which makes oxygen available for muscle contraction necessary for the utilization of energy as part of the cell metabolic reactions system. In terms of its absorption, we usually have the heme and non-heme iron, whereby heme is from the animal sources and non-heme is from the plant sources. So vitamin C enhances absorption of non-heme iron, while the meat promotes absorption of the heme iron. So that tells us that every time you consume a protein, especially the animal sources which are non-heme, you're supposed to consume with the vitamin C fruit thereafter to enhance its absorption. So we have inhibitors of iron like phytates that inhibit the iron absorption inazuia haikuwa absorbed in the mwili. Calcium and phosphorus in milk, tannin in the tea, coffee, nuts, some fruits and vegetables. Also in storage, ferritin and hemosiderin. So with the iron deficiency, mostly it will bring about, it goes into stages, and the first one is iron stores diminish, then transport time decreases, and the hemoglobin production falls. You'll find that sometimes the eye can start being affected so that the sclera becomes white. It affects the white part of the eye, the sclera. It becomes a bit tough and fibrous. Then the immune system, there is usually resistance to infection being reduced and also lowered immunity. And about the nervous or muscular system, there's reduced productivity, tolerance to work and voluntary work, reduced physical fitness, weakness and fatigue, impaired cognitive function. You can't think properly, reduced learning ability, increased ability to pay attention, impaired visual discrimination, and impaired reactivity and coordination with the infant and the infants. And then about the skin, there is itching, pale nail beds, eye membranes and palm creases. There is concave nails, impaired wound healing, and also general reduced resistance to cold, inability to regulate body temperature. And also pica or pica, which means people start eating food that are not, things that are not food, like clay, eating mud, eating feces, charcoal. In terms of its toxicity, the infection can become lethargic, then joint diseases and also pigmentation. So basically, with this nutrient, iron, we can find it in the meat, liver, chicken, shellfish, eggs, legumes, dried fruits, dark green leafy vegetables, fortified flour, and also breakfast cereals. How about zinc? Zinc is a versatile trace element that can be found in the body, and basically you can find it in the seeds and also in the skins of the potatoes. So when you cook such, you should not throw it away. So it helps in the blood and bones and also cell metabolism. Yeah, and basically it helps to boost the immune system and the digestive system function properly. Iodine, again, which is found in the salts, as we mentioned about sodium. Now, iodine will be found in the iodized salts, and it is important for the thyroid hormones to function well, because they're good for growth, for metabolic rate, body temperature, reproduction, the making of blood cells, nerve, and muscle functioning. So, in case of its deficiency, they're likely to result with goiter, which is not good. So you can find it in the iodized salts, seafood, bread, dairy products, plants, grown in iodine-rich salts, and such like. With selenium, again, its food sources are just seafood, meat, grains, and basically selenium is an important enzyme, glutathione peroxidase, that works with vitamins E to protect the body against antioxidants. So that is a summary that I have for us, or information that I have for us about the minerals and vitamins. And I'm not sure if you do have any question. In case you have any, we can engage, but you can read further through your notes and listen to the audio that is here, so that in case of anything, you can let me know, and we can be able to process what needs to be done. So you need to be able to explain what is a vitamin and differentiate it from a mineral. Be able to list some factors that can that's how much vitamin is available in the body, that affect how much vitamin is available in the body. And also you should be able to explain by now different functions of different kinds of vitamins and minerals. Yeah, and also just explain its functionality and toxicity where necessary. We've looked at minerals, and in summary I've said vitamins are essential organic nutrients that do not provide energy and are required in small quantities in the diet to promote and regulate chemical reactions in the body, and they're classified by their solubility in either fat or water. So we do have the fat soluble vitamins that are A, D, E, and K, and the water soluble vitamins that are vitamin C and B. We do have the minerals, which are elements needed by the body to regulate chemical reactions and provide structure, and the bioavailability is affected by interactions with other minerals, vitamins, and other dietary components such as fiber. So in case you have any questions regarding information on what we've learned today, the proteins, vitamins, and minerals, let me know and we shall engage further on this. So for now, bye, have a nice day and listen in.